So three things, three systems which are working together, right? First is hormones, second is nerves, and fourth is vascular. जब ये तीनों साथ में मिलेंगे, when all these three things works together, I think sexual function is apt. So anything which is affecting these three will be giving a term called male sexual dysfunction. Thank you, sir, for this opportunity. So first of all, good afternoon, everyone. I think this post-lunch session, everyone will be quite dull, right? So we'll do a small activity. Just raise your hands and do like this so that I can see, yes, everyone is active. Oh, so all are active. Great, great, great. So I think we'll have a good response in this session. Also, our session is one of the interesting and hot topic nowadays. So I'll be starting it without wasting much of. Yeah, so the topic is pro-sexual nutrients. So why this topic is hot topic? Because a patient who comes to my clinic, the single worry is, sir, aap jo bhi de rahe ho, I should not get addicted, give me something natural. Right or wrong? Yes. Right? That is the need of the patient. अरे कुछ ऐसा देना सर जिससे मुझे एडिक्शन नहीं हो, or it is more of homeopathic or Ayurvedic. That is the word they normally use. So we are going to discuss about that, more of how those products is very useful in male sexual dysfunction. So a very gross anatomy. We have two corpus cavernosa where the blood flows, give erections, testicles which are mainly responsible for hormones, mainly testosterone, and I think everyone is very aware of this. So male sexual dysfunction mainly consists of three things. I have already discussed, like, my whole topic will be around these three things: libido, erection, orgasm. So male sexual function means three things: Leo, libido, erection, orgasm. So anything which is affecting this is termed as male sexual dysfunction. Very easy, right? So what is sex? What do you think? Is it between two bodies or is involvement of multiple systems? So I'll say that emotionally, ऊपर वाला सही है, but scientifically, नीचे वाला सही है. So both are right at their place. So we'll be discussing more of the multiple system because it is a scientific meet, right? Yeah. So three things, three systems which are working together, right? First is hormones, second is nerves, and fourth is vascular. जब ये तीनों साथ में मिलेंगे, when all these three things works together, I think sexual function is apt. So anything which is affecting these three will be giving a term called male sexual dysfunction. So how hormones? So hormones, testosterone is very important. Secondly, nerves, neurons, brain means dopamine, serotonin, which are very important. Third, vascular. So at the corpora cavernosa part, where endothelials is there, which releases nitric oxide, cyclic GMP, and other factors which are affecting the penile blood flow. So three things: hormones, neurons, vascular. Anything affecting these three things lead to male sexual dysfunction, which mainly consists of libido disorder, means affecting the nerves, loss of desire. Second, erectile dysfunction, can be hormonal, can be also vascular, can be neuronal. Third is premature ejaculation, mainly working on the nerves. And third is anejaculation. So these are the topics which are mainly covered in male sexual dysfunction. So as I have already discussed, anything affecting hormone, neurons, vasculars will be leading to male sexual dysfunction. So now we are trying to correlate what other things which is leading to male sexual dysfunction, like diabetes, hypertension, hypercholesteremia, obesity, heavy smokers, alcoholism, psychiatric medication, and BPH medication. All this situation, somehow if you see, are interlinked with all those three cycles which we have already discussed, leading to male sexual dysfunction. So we need to work on something which improves the three systems. So there comes the role of pro-nutrients, like, the nutraceuticals. So is there any comprehensive therapy for the management of male sexual dysfunction? Comprehensive, I mean to say what patient wants. it is not comprehensive for me. It should be comprehensive for the patients. So in patient minds, the only thing works is, please give me something which is sustainable, to which I am not addicted. So there comes the role of pro-sexual nutrients, right? So pro-sexual nutrients in the management of male sexual dysfunction. So keeping three things in mind: hormones, neurons, and vascular. Our pro-sexual nutrients should be working on those systems, right? So the products which we routinely see in our practice is Tribulus terratis, mucuna purins, ginkgo biloba, vitamin D3, L-arginine, zinc, Hypericum perforatum, and Pinus gardenia. Right? I think you all are aware of these things. They are nutraceuticals which are seen in almost most of the products in most of the companies. Just do this, yeah. So what we want? We want something, a testosterone booster which will improve the libido, the L part, dopamine stimulator which will improve the mood, a 5-HT, 5-HT2C enhancer which will control the premature ejaculation, a nitric oxide GMP stimulant, and a penile blood enhancer to give a better erections, and a neuronal NOS enhancer to support the orgasm. So it will cover our three things: libido, erections, and orgasm. So are our pro-sexual nutrients are there who can give me all these results? Yes, the answer is yes to all. So which nutrients will do what? We'll just discuss about it. So there are certain papers which are saying, for example, a study has been done by a Department of Urology and Biochemistry from King George, and they are saying that that a prospective clinical study was done with a drug called Nanoleo, which consists of many of the composition or many of the contents which we have discussed here, and they are saying that it is definitely giving good results. Second, is a normal testosterone level necessary for erectile dysfunction? So the answer is testosterone regulates both the nitric oxide and the PD5 levels, which are both essentials for erection. One will improve the libido, and also second will improve the blood flow to the penis. The hormonal effect of Tribulus terratis and its role in the management of male erectile dysfunction was evaluated using primates, rabbits, and rats. And what they have seen, it improves the testosterone, the testosterone, the DHEA levels, which in turn supports the hormonal things which we have discussed previously. Evaluation of the efficacy and safety of Tribulus terratis in male sexual dysfunction. It's a prospective randomized double trial was done, and it has shown that the IIEF score significantly improved the sexual desire, the intercourse satisfaction, the orgasm level, and oral satisfaction score of the couples improved, which in turn improved the sexual function.
Then they called me.
Dose and time dependent effect of etholic extract of mucuna purines based on sexual behavior was been seen in male rabbits, and this study showed that it increased the level of L-DOPA, and as we have discussed, dopamine is very important in the neuron part, and this will help in giving good mood and also sexual satisfaction. Safety and efficacy of the herbal drug Hypericum perforatum of the treatment of premature ejaculation. It has been seen that the IELT increased from 1.17 minutes to 5.8 minutes, and IIF score ratings are higher for intercourse. Why? Because this drug in turn affects the serotonin and the 5-HT2C receptors within brain. The effect and mechanism of action of Tribulus terratis extract on penile erection was been studied. It showed that it improves the relaxation of corpora cavernosum, while ENOs or nitric oxide cyclic GMP, which in turn improves the penile blood flow, which supports the rigid erection. Last, gross saponin of Tribulus terratis improves an erectile dysfunction in type 2 diabetic rats by repairing the endothelial function of the penile corpora cavernosa, which helps in erections. Long-term high-dose L-arginine supplementation in patients with vasculogenic ED. A trial was been done, and it has been seen that L-arginine supplements for 3 months significantly increased the IIEF score, which supports the maintainable erection. Arginine level is nothing but a prodrug for nitric oxide. So in summary, whatever we have discussed, my point is to just emphasize that in pro-nutrients, like in the nutraceuticals, we have the tribulus terratis, which we know helps in improvement of testosterone, also helps in improvement of dopamine. We have other drugs like arginine, which is nothing but a precursor of nitric oxide, which in turn helps in improving the penile blood flow, which improves the hardness. We even have drug like hypericum perforatum, which improves the dopamine and the serotonin levels of a brain, which is mainly given for premature ejaculation. So each and every parameters of male sexual dysfunction can be treated with this nutraceuticals or the post-sexual nutrients. And on a longer run, maybe initially a higher dose will be required, but later on a patient who has been given allopathy treatment initially can be maintained very well with pro-sexual nutrients, because once the confidence level of the patient is developed, it is just in the brain which we need to support. It may be even give as a placebo effect also. We have seen in the studies also that sometimes pro-nutrients in a suboptimal dose along with an allopathy or without allopathy drugs can be used as a placebo effect for some patients who are having psychogenic ED. Thank you.
Thank you, Priyank, for your wonderful talk.
Thanks a lot, sir.
As you told, can we give nutraceuticals alone? Yes, as you told, when maintenance for their maintenance and placebo effect is good. But if it is a severe ED, we cannot give.
Yeah, sir, the thing is, when a patient comes to me in the OPD, he comes with a very high hopes and he wants instant results. If we are not able to give him instant results, definitely the patient will not stick to us. So in order to give an instant result, definitely I have to add some PD5 inhibitors along with the pro-nutrients. Sir.
Moreover, that triple S and meconoperients the dose we are giving is not so high.
Yes, sir.
That is
so
one thing.
whatever we are giving, sir, they are mainly for maintenance. If you see, an arginine level, if you are seeing, most of the people are giving 250 mgs and all. But 5 gram is what should be given in the initial phase, like for 3 months initially, and then you can step down to 2.5 grams.
And one more thing, suppose if in a very young patient, just a misconception, if we relieve the misconception, and this sort of drugs will help much.
Sir, definitely. Psychogenic ED, I think pro-nutrients are the best drug to start with rather than putting them on PD5 inhibitors.
Good, thank you.
Right, thanks a lot, sir.
I always ask whenever patients comes and tell me, doc, sir, give me something like that which has no side effect, which doesn't have allopathic, which can affect my kidney, my liver, and all these things they have. Okay, if you give me allopathic medicines, it will affect my kidney, livers, and something like that. I always tell them, do you eat pani puri at roadside? The answer is happily yes, sir.
Yes.
Often we do eat pani puri at roadside.
Whether you ask anything.
Do you bother whether that water, how they prepared, whether it's hygienic or not? Instead of that, you'll after eating 5 or 6 pani puri, you'll ask pani puri wala bhaiya ek puri aur de dena na. So you are bothering about the drugs which are giving you results, which are curing you, but you are not bothering for the things which are spoiling your abdomen or your health. So you need to explain. We cannot, patient cannot bargain us ke whatever the medicines they want, we have to write down. We have to write down the medicines which are the best for them.
Definitely, sir. Sir, I think Pani Puri is doing the role of releasing serotonin and dopamine. I think that is right.
Very wonderfully put by Dr. Priyank. So I now request Dr. Murugan and Dr. Paras to please felicitate Dr. Priyank. Please bring the memento. And thank you for such a wonderful talk post-lunch. Everyone was feeling sleepy. He has basically done a very stimulating work. Dopamine and serotonin are released, I suppose.